Experts said mental health was something Americans needed to pay close attention to during the pandemic. The job losses, the isolation, the fear of illness, all very real concerns. So many people expected that the suicide rate would increase as the pandemic dragged on. But new preliminary data from the CDC shows that didn't happen. Instead, fewer people died by suicide in 2020 than did in 2019. To help us understand why that might be the case and to look at the evolution of mental health care, we're joined now by Sandra Brazil-Hamilton, the president of the Tyler branch of the National Alliance on Mental Illness. Good morning, Sandra.
Thank you so much for having me. I appreciate it.
Like I said, there could be some adjustments, but if the number of suicide deaths was either flat or down slightly, contrary to the expectation, what could be the explanation for that?
There could be many factors to that because working in the mental health field, it's traditional that mental health people with mental illness will isolate. People with mental health issues feel that there's a stigma to it. They're afraid to get help, so they don't seek help readily, and it's a fearful thing. It's still something we're not as educated on as. So I think that maybe they were isolated with their families. They had less opportunity to pull off completely by themselves. That's just guessing. I mean, that's total guesswork. I have no data to support that. But having worked in that field, knowing that people that isolate, they are depressed, they have anxieties, there's a lot of different diagnoses that people feel they have to pull away from others. They don't feel right in the situation and uncomfortable. And so that's an understanding that we know working as a mental health worker.
So instead of feeling some sense of otherness and feeling alone, all of a sudden last spring, everyone was isolating together?
Together, and we're in this together, so maybe they felt a little bit more closer to people in that respect, whereas some of us are out in the public felt just the opposite. We felt cut off from society. And so that's just a common thought there, a common sense thought that like I said, don't have any data to support it, but I know that a lot of people were isolated together as families, which gave some support. I do know that the numbers were up for people to call in for help. And that was interesting to me, that people were seeking outside help through Zoom and through the helplines, the crisis lines. The data shows that was up substantially.
So let's talk a little bit about how mental health care changed this last year. And as we do, we'll put the phone number and the website for NAMI Tyler on the screen here. What were some of the biggest changes that you saw?
Well, it changed drastically because like NAMI's the National Alliance on Mental Illness. And so we have always had live groups on education. We have live groups on support groups for those that have mental illness, and live groups for those families that are helping their family members with mental illness. So in that shift in care, we had to go live Zoom. And so now we're opening back up. We're realizing in that Zoom piece that we were able to offer people that were reaching people way out in the rural communities that we weren't able to reach before. And even some that have come from other states have signed on to NAMI Tyler and are seeking our help. So we're happy to have them, but we're very excited to see the fact that we are reaching people that necessarily are shut-ins. They can't necessarily drive into Tyler for help. And we're very excited about that. And then we have also being able to meet live again. We're going to offer that as well so that we don't lose that population. We want to keep them there, give them that support because obviously it's needed. Mental health, though, is on the rise. Suicide deaths by suicide may be down, but mental health issues, mental illness is on the rise. But I think that we're able to do more, and the UT Health System is offering some services for people that need a psychiatrist, that need medication management, and then there's counseling. We've got numerous counselors in the community. So I hope we're covering that for East Texas. Can't speak to other parts of the country, but like California, for instance, their deaths by suicide were down, but their young people were up. they saw the suicide rate go up among their young people. So we've all got work to do to help change those things. And it comes from not just COVID, it comes from every tragedy. That's why I said partnering with companies like Hand Up Network, it's important because we want to serve every part of our community when they have a tragedy happen.
We'll have more with Sandra Brazil-Hamilton on how mental health care has changed during the pandemic. So stay with us here on ETX Covered.